Hello and welcome to this session on the multi-agency neglect audit carried out in Aberdeen City. I'm Fiona Miele, I'm Lead Nurse for Child Protection for NHS Grampian.
And I am Hannah Bennett, and I'm the Multi-Agency Child Protection Learning and Development Coordinator for Aberdeen City's Child Protection Committee.
So what we'd like to do is take you through the 7-minute briefing to share the findings of the audit with you. And we'll start with the background to this, and the question that we posed ourselves in Aberdeen City was, in the last 2 years, have we got better at identifying and tackling neglect in Aberdeen City? So this audit was undertaken as part of the Quality Assurance Framework for Aberdeen City's Child Protection Committee and Children's Services Board. And this was the second audit of the programme for 2020-2021. This also comes from findings from our local initial case reviews and from local and national significant case reviews that have noted the persistent recurrence of cumulative neglect in families whose circumstances were considered as part of these processes. So for the audit, representatives from health, social work, police, education and the voluntary sector met through the digital platform Microsoft Teams to review 21 selected cases. The tool used for the process was based on the Care Inspectorate document, How Well Are We Improving the Lives of Children and Young People, a guide to evaluating services using quality indicators. That was 2018. So the purpose of the audit is to establish the various local improvement activities undertaken to improve identification and response to neglect. Our hypothesis is that there has been an improvement in the understanding and response to the issue of neglect, and that interventions, particularly at the earliest of stages, have been more effective. So we wanted to establish the following and answer the following. How well do we identify neglect across all agencies of the partnership? Does the workforce remain acute to the impact of cumulative neglect? Do single agencies adequately articulate the impact of cumulative neglect in their reports? And how well do child plans address the issue of neglect? What interventions have been effective? And how are these interventions monitored for continuing effectiveness? And most importantly, obviously, have outcomes for children improved? So part 2 of our briefing is around our findings. And there were particular strengths identified, and the particular strength that we focused on was that practitioners are indeed identifying and responding to neglect. There, of course, were areas of improvement, and we found that the naming of neglect with families and the recording of the impact of cumulative neglect was an area that we found was up for improvement. So we want to now focus on some of those particular findings. So we'll start with identifying and responding to neglect. And the results of the audit and workforce survey show that areas of good and very good practice and good confidence levels from a large proportion of respondents in identifying and responding to neglect.
Moving on to part 4, working with families. The audit found that practitioners are using a wide range of assessment tools such as chronologies and risk assessments to support their analysis in conjunction with practice skills such as observation of family behaviours and a clear understanding of the indicators of neglect. Good multi-agency collaboration was also identified through IRDs, child protection planning meetings, core group meetings and looked after children reviews. The audit also found that practitioners were able to identify stress factors experienced by families that likely contributed to neglect experienced by children and young people. Stress factors identified included housing issues, poverty, parental mental health, and domestic violence. In 90% of the cases audited, support was offered to families to help mitigate the impact of these stressors. The pre-birth team and SALT, or speech and language therapy, were both highlighted as being of particular importance to improving outcomes for children and families. Part 5, recording the impact of neglect. In cases that were marked by auditors as having evidence of being acute to cumulative neglect, there was focused work and ongoing monitoring of the impact of neglect, and the measures taken to mitigate risks were reported. In other cases, however, auditors felt that the lived experience of neglect was not being properly identified or considered, as a lack of ongoing analysis and assessments were found, along with incomplete case notes seen in Care First. There was therefore unclear or little description of cumulative neglect found in some case files. This finding was corroborated by the workforce survey, as cumulative neglect was mentioned in just 4.6% of practitioners' responses, which supports the audit's finding that just 6 out of 21 cases audited were acute to cumulative neglect, even though the individual indicators of neglect were widely mentioned. So it could be that cumulative neglect is being assessed, but is not being framed as cumulative neglect. With regards to naming neglect with families, looking at the results of the audit alongside the workforce survey, there are some good and very good practice and confidence levels from a large portion of respondents to identifying and responding to neglect. However, there is still room for improvement in responding to neglect, and there is a need for more confidence in naming neglect with families. 33% of the cases audited were marked as adequate. They were not looked at through the lens of neglect. Case notes were written with concerns that were not backed up with evidence from assessment tools. During audit discussions, auditors agreed that it was almost as if there was an anxiety in using the term neglect with families. Part 6, what's happening now? Aberdeen City's CPC Neglect Thematic Group will ensure that neglect continues to receive the attention it requires in accordance with our frontline multi-agency work. It will also ensure the recommendations from this audit are implemented. This will include a focus on increasing practitioners' confidence in naming neglect and recording the impact of neglect to ensure the lived experience of the child is recognised. The guidance on neglect will be updated for practitioners to ensure that it reflects the definitions from the new National Guidance for Child Protection and includes the national framework on neglect that CPC Scotland has recently published. All of these resources will be presented in the form of a toolkit for easy access for our workforce and will be available via the Aberdeen Protects website. Part 7, suggested next steps. Now that we've provided an overview of this thorough multi-agency audit, our suggested next steps are for you to bring this 7-part briefing to your next team meeting for further discussion. Identify one strategy from this audit that you will implement to improve practice, and attend one of our local multi-agency training sessions on neglect if you haven't done so already. All future training courses can be found on the events page of Aberdeen Protects. Thank you for listening, and if you have any questions, please get in touch with the Child Protection Committee's lead officer, Amy Anderson. Thank you for listening.